Hi everyone. Let me ask you a question. What treatment in an emergency is administered by ear? Does this question baffle you? Well, before I answer that question, let me tell you where I found this question and its amazing answer. This is from a wonderful book called Cutting for Stone that I came across a few months ago. It's a bestseller with over 1 million copies sold worldwide, written by Abraham Verghese, a practicing surgeon in the US. In the book, the author describes a scene where the protagonist, Dr. Thomas Stone, a well known surgeon, addresses a gathering of medical students in America. He was bringing to their attention something that went wrong with their surgery. To drive home his point, he read out a letter from the mother of the deceased patient addressed to Dr. Stone. Since the letter is a bit too long, I'll just share the content in brief. Apparently, this mother had lost a son after he underwent a surgery conducted by a team led by Dr. Stone. But that's not what she had an issue with. She was anxious by the fact that her son had some horrible last moments before the surgery when the doctors did not appear to show any concern for the anxiety of the mother or the son, and they were only busy with his body. She says, "My last memory of my son will be of my little boy watching in terror as his mother is forced out of the room, leaving him frightened. The fact that doctors were attentive to his body does not compensate for their ignoring his feelings." After reading the letter aloud, Dr. Stone folded it, put it away in his breast pocket, and stood there. There was total silence. And then, in a quiet but firm voice, he asked this question: what treatment in an emergency is administered by ear? There were about 200 people in the room, but no one knew the answer except one. And the answer was words of comfort. Friends, there is a reason why I am saying this today. When I read this passage from the book, my mind went back exactly 2 years when I was admitted in St. John's Medical College in Bangalore for myocardial infarction, in layman's words, simple heart attack. It was a triple vessel disease and I needed bypass surgery. Although I was in the reputed St. John's Hospital, due to the seriousness of the problem, I had to be taken to the specialist heart hospital Narayana Hrudayalaya, some 17 kilometers away from St. John's. The day I was to be shifted was eventful. As I was wheeled out of my room at St. John's, I saw a crowd outside, all of them my friends and well-wishers, talking in hush-hush tones, some looking very somber and some folding their hands. A few of them walked up to me and held my hands and gave me a lot of assurance and praise. I was escorted to a waiting ambulance sent specially from Narayana Hospital with a doctor in tow, with all possible equipment, lest something happens to me on the way. It was the first time that I was in an ambulance. The doctor kept checking my pulse every 10 minutes on the way and monitored my heartbeats. Although I had felt normal after a few days of treatment after the attack, the scenes around me gave me a fright. I started to really worry if there was something seriously wrong with me or if I would survive at all. Soon we were at the casualty department of Narayana Hospital. Seeing many patients like me in that hall with people wailing all around me, I lost my sense of balance. I thought I was done with this world. In about a few minutes, I was assigned to a doctor. And before I was taken to this doctor, my family members and some of my friends had already had a conversation with the doctor and were waiting for me to be brought in. By now, I had mentally prepared for the worst. As I was wheeled into his room, unlike what I had expected, I was in for a pleasant surprise. I saw the beaming faces of my dear ones, and I saw a man of pleasant face wearing blue scrubs and welcoming me, saying, "Welcome, Mr. Shibu. I am Dr. Ramesh Shadri, your doctor." What followed were several minutes of conversations during which the doctor explained what he was going to do to me, how safe the procedure was, and that he was an experienced surgeon performing an average 4 bypass surgeries a day, and that I was safe in his hands. And he said he wanted to see me leave the hospital in a week with renewed strength. I tell you, friends, I never felt safer in my life. Not only I, my entire entourage of people just loved this doctor. And I'll tell you, I could not wait for the procedure to happen. I was already feeling completely cured. So now you understand why I put that question in the beginning. What treatment in an emergency is administered by ear? Words of comfort. Yes, that's what Dr. Ramesh administered to me that day. I had similar pleasant experience when the next day I was taken to the founder of Narayana Hospital, Dr. Devi Shetty, another great human being who makes you feel that bypass surgery is just another injection that you take. On this doctor's day, I fold my hands to thank all my dear doctors and hundreds of others who make this profession noble by administering the emergency treatment by ear, words of comfort. Thank you, dear doctors, and happy Doctors' Day.